anybody has any
Thank
question?
You. Thank you, Chris. We'll take a few questions now, and as I said earlier, we'll have more questions after all three speakers have spoken. Are there any questions from the audience right now? Bruce.
I can. Oh, okay.
The Common Breast Cancer Organization in the country spends a lot. I don't understand your numbers why it's young, because it's the young that are raising all the money for pink ribbons, big marches we have all over the country and all the rest. So I've been active with them in the past, and they recognize this issue, okay, commonly among the group, but their view tends to be that it's based on a statistical analysis. They believe that 50% of the women in the United States have a precondition toward breast cancer. They use it as a genetic trigger. Have you looked at your data and broken it down to that group, which we can now identify who they are, versus the rest of the group? And is that a common indicator that you get an even bigger spike for the breast cancer and a lower spike on the other side? Or hasn't the data been collected at that level yet?
Well, to answer the question, 2 or 3 things. One, just to remember that none of this is my data. All we did is we took studies that have been out there, analyzed them, and put them together. So, in general, from our study, we can just say that women basically have about 44% increased risk of breast cancer before the age of 50 if they took the pill at a young age. Now, some women have a genetic defect like BRCA1, BRCA2, or another, and it seems as if taking the pill still increases your risk in those women. But those are usually a small percent. Most women, if you have a real strong history of breast cancer in your family, most physicians don't really want to put you on the birth control pill. So what we're finding is probably women who don't have, these studies are probably women who don't have that particular gene usually. So I'm not sure if I answered, there was one other question in there. I'm sorry.
Just not looking at those who have the genetic defect, which probably is about 1/3 of all women in the United States have that, okay, because of your European descent. It's the other batch. Is there a difference in the cancer rates between those? It appears from your question that your answer that you haven't collected enough data because you didn't control the study that way. You're just rolling everybody's studies together.
Yeah, well, what we're doing is, that's right, we take all the studies in the world, and some of those probably have family history and some of them don't. So ours, I can't break that down, and I'm not sure anybody's been able to. So if you wanted to do a study more specifically, and there's some smaller studies that do show if you have a family history, it does tend to increase your risk. But the real heavy gene, like BRCA1, BRCA2, that's a smaller percentage of the population. So our studies, I'm not sure you could break that down. I'm not sure anybody could. But I tell you one other thing. The big societies, American Cancer Society, National Cancer Institute, they recently came out with a paper, and a woman, one of the authors, her name is Louise Brinton from the National Cancer Institute, one of the leading researchers, and she wrote a paper and said, the birth control pill and induced abortion are risk factors. It was very clear in their paper. The problem is that some people give a little bit of lip service to this, but virtually no women that I've ever seen who are put on the birth control pill get any real warning. And they get that little tiny pamphlet which has scribble about the size of microns, And what you'll read in the fine print is some studies show that if you take the birth control pill for a prolonged period of time, it may increase your risk, but that risk goes away after 10 years. First of all, women don't read that. Secondly, they're never told by their physician. And third, if they said, 21 out of 23 studies show an increased risk of 44%, and if you get cancer before age 50, it's very aggressive, I'd say 10 or 20% of women wouldn't even take the pill. But they never told that until they get a lump in their breast, and then they have 3 kids, and it's very sad.
Any other questions? Bonnie?
I'm just interested 10 years later, you're more susceptible. But then before you had said 10 to 20 years. So that's my first question is, which is it? Are you more susceptible for 20 years or 10 years after taking an
Oh,
Alzheimer's?
well, what I'm trying to say is that the original study, the Oxford study, the older one that everybody quotes today, they continue to say, and the National Cancer Institute, American Cancer Society, all the medical groups say, don't worry, after 10 years after taking the pill, your risk is the same as everyone else. And that's definitely not true according to what we're finding, because they used older studies and older women. If you look at our Mayo Clinic analysis, it's very hard to tell how long the risk is, but the risk continues to go. There's no decrease after 10 years from what we're seeing, but we can't measure it that accurately because our study was a little different than the first one. But there's nothing to indicate that your risk goes away after 10 years. And from what I'm seeing in our study, it probably stays the same. It may even go up. But that statement doesn't appear to be valid. So they shouldn't be saying that, but they do. They keep ignoring our study, and they keep going to the older one.
Well, that also just makes me really wonder. Now they're putting young girls on the pill for acne, right? At 15 or 13. I mean, so they're basically increasing their chance of cancer for the rest of their lives when they do that, correct?
That's right. And what you'll hear often is, the pill is good for ovarian cancer, it's good for uterine cancer, it's good for acne, it's good for contraception. And it's like, well, okay, those things are true, but you're not telling them about possible abortifacient effect, increased risk in breast cancer, increased risk in cervical cancer, increased risk in liver cancer, increased risk in blood clots, and we just had a young lady who came in with a stroke, and none of the doctors asked her about the birth control pill, as if it's this hidden ghost that everybody's afraid to look at or address. And I was the first person that asked her because I thought, you're 46 years old, you don't smoke, why did you have a stroke? Well, I was taking the birth control pill, there it is. So the problem is women really aren't getting informed consent, and it's pretty sad.
Okay, thank you, Dr. Kahlenborn. We're going to hold the rest of your questions for Dr. Kahlenborn until the end of the session, and we're going to switch now to Dr. Michael Parker. When a woman first discovers a lump in her breast, she probably goes to her primary care physician, and she's a mature woman, that's probably her gynecologist. And so Dr. Parker represents obstetrician gynecologists here this afternoon, and we want to hear from him what he says to a woman that comes to him with a perceived lump breast in her lump, and what happens after that. Dr. Parker?
Thank you, Steve, and thank you, everybody, for coming. And it's truly an honor to be up here with Dr. Kahlenborn and Dr. George. I feel they're much more distinguished than I am. I think Dr. Kahlenborn's book was very influential in my decisions as an obstetrician gynecologist